Hello, my name is Anisa Yanala from Mozambique. I'm general practitioner collaborating with the Genetics Medical Service at Maputo Central Hospital. I'll present the topic: should genetic testing for psychiatric condition be implemented in African healthcare systems? I am in the Affirmative Team. Mental health disorders are rising across Africa, while healthcare systems continue to face major challenges. Introducing genetic testing for psychiatric conditions could be a key solution. These tests can improve diagnosis, help to predict how a disease will progress, and make treatments more personalized and effective. While other medical fields, such as oncology and cardiology, already use genetic testing widely, psychiatry in Africa still depends mostly on basic clinical tools and faces significant diagnostic limitations. It's crucial for African healthcare systems to integrate genetic testing into their healthcare service. This innovation has the power to transform the way psychiatric disorders are diagnosed and treated on the continent, moving beyond the traditional limitations of symptom-based assessments. We brought here some arguments to defend the implementation of the genetic testing for psychiatric conditions. It can improve the diagnostic accuracy and prognosis. We know that some mental disorders like schizophrenia, bipolar disorders, and autism spectrum have genetics factors. That's why using genetic testing can help African psychiatrists to detect underlying genetic syndromes and improve medical decisions making. We can have support for personalized medicine through pharmacogenetic testing. We know that many African populations have unique genetic variations that can affect how they process psychiatric medications. These tests could help healthcare providers to reduce side effects and increase treatment success by selecting the right drug and those based on the patient's genetic profile. We can have long-term economic benefits. How? Genetic testing could reduce future healthcare costs by lowering hospitalization rates, minimizing adverse drug reactions, and improving accuracy of diagnosis. It can reduce stigma and empowering patients. We know that in Mozambique, they think that mental health disorders result from evil spirits. That's why many patients live in chains and suffer mistreatment. Providing family and patients with clear genetic explanations for mental disorders can reduce the social stigma and can also empower patients to better understand their conditions and actively participate in their treatment. It can strengthen collaboration between psychiatric and clinical genetics. Genetic testing will encourage the creation of multidisciplinary teams combining the expertise of psychiatrists, genetic consults, and lab specialists. This will raise the quality of mental health care, help local health systems adopt modern evidence-based practices. Here we brought the arguments from the negative team for cultural context and beliefs. We can collaborate with community leaders, religious figures, and traditional healers to build trust and explain genetic testing in ways that respect local beliefs. We can develop culturally sensitive mental health and genetics education campaigns to reduce stigma and misinformation. Healthcare infrastructure. We can invest in training for doctors, psychologists, and genetic consults in both mental health and genetics. We can integrate genetic testing into existing mental health programs rather than creating new standalone systems. We can expand access to genetic counseling to help people understand their test results. About economic consideration, we can build partnerships with NGOs, international donors, and private organizations to fund programs. We can ensure policies include subsidies or free testing options for vulnerable populations, launch pilot projects to assess feasibility and cultural acceptance before scaling up. For ethical and privacy concerns, we can strengthen data protection and anti-discrimination laws to safeguard people's genetic information. We can create simple, clear informed consent procedures adapted to local literacy and language levels. About scientific limitations, we can fund more genetic studies focusing on African populations to ensure findings are relevant. We can promote collaborations between African and international research institutions to share knowledge and capacity. And about potential for misuse. We can highlight that genetic testing should complement psychosocial and community-based approaches. Invest in prevention and psychosocial service alongside genetic tools. Bringing genetic testing into African mental health service is not a luxury. It's a necessary step toward modern and effective healthcare. International experience shows that genetic tests lead to more precise diagnosis, more successful treatments, and lower healthcare costs. For Africa, implementing this technology will help bridge the gap between the continent and the higher income countries. Delaying this progress will only prolong outdated practices and limit the benefits that precision medicine can bring to African psychiatry. To make genetic testing work for mental health in Africa, we need to move step by step. It's important to respect a local culture, protect people's rights, and make sure mental health services are strong and available to all. Thank you. Do you have any questions? I'm here to answer all.